Hi guys, welcome to this live chat about sciatica. So I'm just going to wait a minute or two just to allow everyone to filter in and then we'll get started. All right then, I think we'll just get started. So I'm going to start with just a little bit of anatomy and just kind of explaining what sciatica really is. So sciatica is a term that's used to describe pain that originates from the lower back and can travel down into the buttocks and the posterior, so the back side of the leg. It tends to be kind of like a pins and needles shooting type of pain that comes down into that area. That tends to be sort of like the main feeling that people complain of, and it occurs due to some irritation of the sciatic nerve root, not the nerve root, sorry, of the sciatic nerve itself. So yeah, not a very nice pain to be feeling. So just a little bit of information about the sciatic nerve itself. So it originates from the lower part of the back, so from the nerve root that's attached into the vertebrae, and it runs from the lumbar vertebrae, so L3, L4 to S2, so the lumbar and the lumbar spine, and then the one below as well. And then it runs from there down through the pelvis and behind the piriformis muscle, which is a small muscle in your buttocks, and then down to the knee, where it then splits in two and supplies the lower leg. And its purpose of the sciatic nerve is to innervate the muscles that it travels past, so mainly the hamstrings, so the back of your thigh is the main muscle that it tends to innervate. So it gives all the electrical signals to that muscle to be able to allow it to contract properly. So sciatica itself is used as a term, is probably overused as a term, and true sciatica is only affects sort of 10% of the population, and true sciatica is kind of categorized as pain that extends down past the knee and is caused by inflammation or impingement to the actual nerve itself. Okay, and I think this is one of the reasons why I wanted to do a video on this topic, because I see a lot of people coming into clinic with lower back pain and with some pain that runs down the back of their leg, and they've been told, oh, it's sciatica. But truly, sciatica, is that sort of pain that extends particularly down past the knee and into the lower leg and into the foot, whereas what a vast majority of people, obviously not everyone, but like I said, it only affects about 10% of the population, and so you can also get pain that is caused by the sciatic nerve. However, it won't go past the knee, and it's due to an irritation within a muscle or within the joint, within the hip joint predominantly, and that is what's causing the pain that you may be getting. So it's a similar sort of pain, but there's key differences as to what is sciatica and what is from pain from the sciatic nerve, and I think that's one of the main sort of things that I wanted to cover this evening, is making sure that sort of we understand the difference between the two, because they tend to be two very different They can be two very different ways of treating it as well, because obviously in true sciatica you're dealing with a nerve, whereas in pain from the sciatic nerve you're treating a muscle or a joint, and so it can be very different. In terms of how this sort of pain is caused, it can be caused from a variety of issues. So these can include a herniated or bulging disc at that lumbar level. So like I mentioned in my previous video, when the disc sort of impacts onto that, starts bulging and impacts onto that nerve root, that can then cause a great deal of pain and send the pain kind of shooting down the leg. And also, like I said, in pain from the sciatic nerve rather than true sciatica, it can be irritation of the soft or hard tissues around the nerve. So say you've got a muscle that's slightly inflamed, slightly swollen, you might slightly damaged, you might find that then impedes onto the nerve itself, and that then restricts the signals going down, and that's what can cause some of your pain. Symptoms that you may be feeling when it comes to sciatic nerve pain is a lot of pain in the lower back, so from where it originates, and then also that sort of shooting feeling that can go into the buttocks, into the back of the thigh, and then also in that true sciatica it can unfortunately head down into the lower leg and into the foot as well. Typically it happens on one side, so it'll either be your left or right. It can happen in both, but that's a bit more of a serious sort of issue that may be going on. But again, that's something that we can help with in clinic, and through our assessment we can kind of work out the best form of treatment for you. It can also cause sort of like a burning sensation, so these neural symptoms that they're described as, so things like pins and needles, numbness, sort of altered sensation going down the leg compared to the other side, is quite common with this sciatic nerve pain and with nerve pain in general. So that can be something that a lot of people find that they are struggling with. So if you sort of are struggling with those sort of symptoms and you were to come into clinic, what we would do is we would get some history about the pain, and we would like get to know how it sort of started, and try and understand sort of how long it's been going on for. And then we'd also do some simple tests that help to test the integrity of the nerve, and can help to sort of identify some of these symptoms and really work out where they might be coming from, and that can also indicate to us whether it's sciatic nerve pain, true sciatica, whatever it might be. And so obviously all of that is stuff that can greatly affect your life. If you're suffering with this sort of pain and you're really struggling, it can affect your work, your hobbies, your sport, whatever it might be, your daily life, if you're really struggling with this. And so there's many ways that we can help within clinic as therapists. And so like a lot of other issues that we see, a lot of it comes down to pain and symptom management. And so how do we do that? So it can, strengthening the muscles around the lower back to try and help to, if there's some issue within the vertebra level, so whether it's a disc issue, that's something that, strengthening the muscles around the area can really support with. If it's this sciatic nerve pain, stretching and sort of loosening any tightness within muscles, or tightness within the joint that may be obstructing the nerve in some way, is again something that can really help with your outcome and your symptom management. And then also there's some nerve specific exercises, so what we call nerve flossing, and basically what that's trying to do is just trying to get some movement through the nerve. So we'll stretch it and release it at different parts of the, so at the spinal level, and then also at the peripheral level. So in this case, by the knee or by the foot, by the ankle, to really try and get some movement back into that nerve, and just trying to reduce any sort of inflammation, any sort of impingement that may be going on in the case of like true sciatica as well. And these sort of symptoms with like interventions that I was talking about tend to be resolved within sort of 4 to 6 weeks is a timeline that's generally given for these sort of issues. But however, in more severe cases, they can lead up, symptoms can be felt for up to a year, and so it's something that we really want to be able to treat nice and early, so that we can get the best sort of help for you, and that we can really try and tackle it as quickly as possible, to not allow it to go for long periods of time, because obviously tends to be that the longer you have it, the longer it then takes to go away. Okay. And so if you are feeling any of those sort of symptoms, so any sort of big pain in the lower back, any sort of shooting pains into the buttocks, into the back of the leg, any sort of neural symptoms that I was describing, feel free, give the clinic a call, give us an email, we'll get you booked in and we'll get you assessed, and really try and get you started on the journey of reducing and getting rid of your symptoms. If you have any questions at all, please leave them in the comments, and we'll happily get back to you as soon as we can. Hope you've enjoyed it, and I'll see you again soon.